Okay, I'm not going anywhere.
And we are live.
Okay, good morning, everybody. Today is April 2nd, 2020. We are holding a special work session of the Board of County Commissioners on a Thursday because we have some business we need to tend to. I think that only Patty is there in our meeting room. Is that correct, Patty?
That's correct.
And the rest of us are working from home. So our discussion today will be, the first thing will be about the Rafter service discussion with regards to the COVID-19 virus. So John Peacock will be showing some slides on here. Go ahead, John.
Thanks, Stephen. I'd note I'm also in the room with Patty, but I think we're 12 feet apart, so we're doing a pretty good job on the social distancing. I've got two mics on, Amy. Is that working? Okay. Sorry, we're having an audio kind of issue here. So really the purpose of this discussion was to give the board a little bit of time to talk about a conversation that will happen at the Rafter board meeting tomorrow, where the Rafter board will be considering whether to further reduce or suspend bus services. Just as a quick note, a supermajority of the board is required to vote to suspend services. At the last meeting, this was an item that was discussed, but not all board members were represented in that discussion, and so the conversation was delayed until this Friday. As we started off, we've just set aside time today so that the whole board could discuss this issue and provide some guidance to our Rafter board members. The reason this is an important discussion is this is one of those right versus right kind of questions where we have essential services that we are trying to keep functional throughout the duration of this event. Rafter is considered one of those essential services because it really provides the safest way for many employees who provide essential services. And for the purposes of this event, essential services in our public health order include groceries, healthcare, pharmaceuticals, pharmacies, essential infrastructure like utilities and internet, hardware, gas stations, so on and so forth. There's a full list in the public health order. Right now, a survey of employers providing these essential services in Pickens County. This is a snapshot as of yesterday. We identified approximately 90 employees that rely on Rafter right now to reach these employers to provide these services. It is not inclusive of people in our community that may rely on transit or public transportation in order to access these services. We right now do not have good numbers on that.
Hey, John?
Yeah.
Excuse me, Greg here. Just want to make sure I'm clear. A survey of essential businesses showed 90 employees total in Pickens County rely on transit, or is this Pickens County staff? I just want to make sure I understand.
No, that's for like the grocery store. This is under our kind of reduced services right now. So, Greg, under normal circumstances, of course, these numbers would be much, much larger. But right now, this is outside of Pickens County or City of Aspen. This is in discussions with our grocery stores, pharmacies, so on and so forth. Okay. So I'd also note that our public health department and IMT have been working closely with Rafter. I think there is a comfort level that Rafter has been doing a really good job in working through. They've got a well-developed pandemic plan that they've been working through. They have been taking actions to make sure that social distancing can be achieved on the buses. That includes not having fares at the front of the buses to limit the interaction between riders and drivers. They're requiring entry at the rear of the bus. They've been able to rope off areas on the bus to encourage social distancing. Of course, all of these efforts have been greatly helped because the load factors now are so low because so much activity has been restricted through our public health orders. I guess with that, George, you had indicated right before we started this meeting that you have some additional or new information that I did not have from Rafter, and maybe, Steve, if it's okay, we could invite George in to give that update.
Okay, great. Thanks, John. Just a small correction first. Last week, we had our first special meeting with Rafter, and there was a motion on the table to actually suspend service. And that motion failed because we did not have a supermajority, so we did go to reduce service, phase 3.
Thank you.
The numbers since the first cut, starting on March 9th, the numbers in terms of Rafter Highway 82 users was 7,535 passengers on that day. Now with phase 3, the number of passengers on the Rafter Highway 82 route is 703 passengers, so down about 90%. Within the city of Aspen, before March 9th, there was 4,471 users. Now, since we've gone into phase 3, there are now 321 users. So you can see the people who are utilizing the bus service has substantially been reduced by 90%. Rafter is also doing a short mobile message service survey, trying to determine what types of trips the passengers are taking, if it's for work, for food, for medical supplies, or other, and also what other options those riders may have, whether it be cars, bikes, walking. And we should have an update on that tomorrow. The City of Rifle last night considered a resolution temporarily suspending Rafter bus service to the City of Rifle from April 3 to May 6, and that passed on a 4-3 vote. The city of Glenwood Springs may be considering that today, so that will be a topic of discussion with Rafter tomorrow as well. It's interesting, the concern from our Down Valley members is they voice a concern in terms of having riders get on Rafter coming up to Pickens County and then perhaps being exposed to the virus and bringing it back to the community. My concern, I think Greg's as well, is actually just the opposite. We're actually concerned about riders coming up from outside Pickens County and bringing the virus with them. So that was sort of the discussion and the debate we had last week, and I'd asked for an ongoing monitoring system, and that's why we're having another special meeting tomorrow. So that's sort of the long and short of the discussion. It may be noted that at our last special meeting, City of Glenwood had voted to suspend, Town of Carbondale had voted to suspend, Town of Basalt had voted to suspend. Greg and I had both supported that as well. I think we were really concerned about, at this point, given the volatility and highly contagious nature of this virus, the danger of, or the cost benefit of transporting people versus transporting the virus. So that's a tough issue, tough discussion.
Thanks, George. And this is what makes this a right versus right kind of conversation, is that those are all legitimate issues to be managing at this point. I think from public health's perspective in Pickens County and the incident management team's perspective in Pickens County, the benefits right now of keeping transit open to public health outweighs the risks, and there's a few reasons that public health here, as well as the incident management team, has taken that position. First, there's multiple determinants of health, and obviously the businesses that were listed as providing essential services to the community are significant contributors, whether it be just the ability to get food, get medicines, get supplies from hardware stores that may be critical maintenance items and such. All of those were considered as being important for maintaining public health throughout the pandemic and maintaining access to those services. We understand that there's a large number of employees that rely on public transit who are providing those services. I think the concern is that in the absence of public transportation being available, one of two things happens. One, those employees are either not available to continue providing those services, or two, that they're finding alternative methods, either via carpool or ride sharing, or other methods of transportation that actually are more challenging to achieve social distancing in, and you increase the risk of infection both directions, whichever direction the employees are traveling. And so right now it's been the position of public health and the IMT that transit is considered an essential service for moving these employees, and that right now it remains the safest way to do so. That is not to discount the concerns that the Rafter board members considered, because it is true. There's still vectors. What we're trying to do is minimize risks and balance these other kinds of considerations. One more piece of information. This is from the Symptom Tracker data that's being reported in Pickens County. And then we also polled Eagle counties, which unfortunately every time I scroll down I get this little bar that covers it. Is there any way to stop that? Oh geez, that wasn't it. Give me a sec. The best thing to do is not move my mouse.
That'll go away when you stop moving your mouse.
Okay. Well, eventually you'll be able to see at the bottom of the screen. This includes information for eligible and Minturn. Obviously, the scale is just a little bit different for our reports, but to give you a sense, in Aspen, if we're looking at fever, right now you have just over 50 people reporting that symptom in Aspen. Under about 12 and a half. Good Lord, my phone will not turn off either. I'm having technology issues. Just under 20. And then in Snowmass, you all are covering it on my screen, so I can't see. You can see in Basalt and Elgibel. Basalt, you have about 22 people reporting fever, 13 in Elgibel. This is right now just kind of real-time data that we're tracking. I'm going to talk about it a little bit later, but I thought it might be a little useful just to kind of see how symptoms are tracking in the valley. I do not have results for Garfield County right now.
John, what was the numbers for in Snowmass?
So let me see if I can move this. So Snowmass, fever, you're at about 12 people. Now this is
50...
self-reporting. This is self-reporting.
Reporting, okay, yeah. Great, thank you.
And again, it's just to kind of give you a sense of at least the symptoms. Not everyone that has symptoms has necessarily logged on to our website and done this yet. But right now, this is probably the best leading indicator data we have.
John, how many have done the self-reporting in Pickens County now?
Give me just a sec on that, Steve. Because I'm just gonna flip through a couple slides because I was gonna talk about that a little later. The data that's being shown is based on 256 responses.
Okay. The reason I ask is in the CCI Mountain District meeting yesterday, Summit County in just 1 week, they had well over 1,000 people doing the self-reporting thing. They had really a lot of success, a lot of people coming on right away. And that's why I was asking, so we could compare us to Summit County.
Well, one of the things that you can see, and we'll talk about this a little bit later, that's hopeful in our data, but you can see what's happening with our onset of symptoms information. It seems to be right now responsive to the timing of our public health orders. But again, Steve, hopefully we'll get more folks responding to that. So I think there is definite concern. If Rafter does close down, we will be faced then with trying to figure out how to maintain the essential services. So we will still be needing to find a transportation solution for those employees at least to maintain the essential services being open. I think that's probably the IMT's and public health's biggest concern is what that alternative would be. So with that, I think George and Greg, you are our representatives to the Rafter board, if I recall correctly. I think it'd be good for the board just to have a little bit of conversation to help inform our representatives to the Rafter board before any decisions are made tomorrow. Is that a fair thing to kick back to you guys at this point?
Yeah.
So
that sounds good. If you want, I can just share my thoughts on it. Yeah, George and I were on that call. As you said, I think it requires a supermajority, and we didn't get that. So the motion to reduce service did not, or to suspend service did not pass. But we've got I think we're very close. I guess I could be convinced either way right now. I understand the need for these essential people. If we have 90 people doesn't seem like very many, and there's probably a few more we hadn't thought of. But I'm just wondering, and I think George proposed, perhaps there's an essential worker pass that could be distributed to people who absolutely need to use that bus service, and we could have the passengers use an essential pass just to control and limit how many people are using Rafter, or to focus on when Raft is needed. I've been talking to Dan. I know he's been ordering masks, and we've talked about distributing masks to every passenger. With the passenger count so low, we can probably do that, and we actually have discussed the network of seamstresses in the Valley who are ready, willing, and able to start making just a basic public mask. They're not going to try to do an N95 or a medical mask, but just a cough screen sort of mask for people to wear, because that seems to be becoming more a popular idea that certainly worked in Asia and works. They just do that as a matter of course there. So we talked about increasing the mask inventory for Raft, and maybe handing out free masks for bus passengers to increase the sense of safety, and also it helps people avoid touching their faces as well as capturing a cough. I think I proposed in that meeting what I hear is happening elsewhere. There's much more aggressive temperature screening, and there are ways of screening someone's temperature very rapidly. And I know asymptomatic carriers might not have a temperature, but if someone does, it probably means their viral load is much higher, and they should be separated from the herd, so to speak. And maybe getting on a Rafter bus is a place to have your temperature tested. Just a thought that I put out there, and I'm not a doctor, so I'm just wanted to say this is what I've been hearing on the grapevine. And then finally, the last suggestion I think I made at the meeting was that if we're down to 90 essential passengers, we probably have 90 Rafter bus drivers out of work right now, or some huge number that might have to remain employed. Can we start, I was going to suggest that Rafter might create a ride service, individual rides. If there's some senior citizen that needs to get somewhere, a Rafter driver takes a personal vehicle or a smaller vehicle and picks them up. So if we're going to suspend service, we may still be able to take care of these essential workers just by coming up with other solutions. And I'm sure there are a lot of reasons why these things can't work, but I did want to propose them. Thanks.
The other thing, just to tag on to Greg, is if we were to suspend service, we would still continue the travelers and the senior services van. So I think what Greg is saying, maybe there's an opportunity to even expand that concept, the travelers and the seniors, to some of these other essential workers.
And just a couple of things to consider. I think from a public health perspective, we're trying to limit putting multiple people who are not in a family unit in small private vehicles, because you can't achieve social distancing there. You can achieve a 6-foot distance on a bus. And I think that was one of the main considerations, because the buses right now are not running efficiently, that's for sure. There's not very many people, to George's point, for such a large vehicle, but it does provide the opportunity for social distancing, which is one of the reasons that I think public health was viewing that as preferable to a ride-sharing option. So I just throw that out there, Greg, to consider.
Steve, could I comment?
Yes, go ahead, Patty.
For me, the concern is we've been following the recommendations of our Board of Health and our incident management team, as we did with construction. And now if we vote to suspend service, we're not following their recommendations. So I think the Board of Health is who we rely on to make the best decisions for the protection of public health. So I think we need to take their recommendation with great merit in making this decision. I am not supporting suspension of service. I'd like to see if Rafter can pare it down a little bit. It's not just providing transportation for the essential workers in Pitkin County. we also have to think about those workers that go to the grocery, that work at City Market or Whole Foods in Willits or in Carbondale. How many of those workers rely on Rafter to get to and from work? That's going to put more pressure on people, as John said, to pack into one car, which we are avoiding with construction workers, which was our big issue. Construction workers riding up in the same truck to come to a job where they could social distance when they got to the job, but they weren't able to social distance in the private vehicle. And now we're kind of pushing people in that direction, which to me flies in the face of the reason why we restricted construction. I think we need to be very careful in hitting the people that are working and are working to provide those essential services throughout the Roaring Fork Valley. And I just can't be supportive of a full suspension of Rafter mass transit, public transportation. We've spent how many years telling people you don't need a car, you can rely on bus service. And so how many people don't have the opportunity to drive a private car up here, even if they're by themselves, because they rely on Rafter. And we're taking that one opportunity away from them to get to work to provide those essential services. Thank you.
Kelly.
Hi, thank you, Steve. You know, I agree with Patty. I think that the public health, you know, they are weighing the health impacts with regards to the virus as well as the social determinants of health, with people needing to employ our essential services and utilize our essential services. I think, you know, maybe some sort of essential pass could be fettered out, and I have no opposition to the use of masks, you know, if they're protective or not. I guess I wonder, if there is a suspension of service, what is Rafter's ideas about transporting people who need to use these essential services as opposed to those who are employed at them? George or Greg, do you guys know that?
Well, as I said earlier, Kelly, that Rafter is doing this short little survey trying to determine who's riding the bus and what sort of, if they have any other alternatives or not. And we'll hopefully have some of that information presented to us tomorrow.
Mm-hmm. Yeah, because I would continue to be concerned about people who have no other way to get around. And I do think that Rafter has been very thoughtful, and you know, they do have very good plans in place that protect people to the greatest extent than would be achieved if people had to figure their own transport out on a one-off basis to fit with our public health order. Thank you.
So my thoughts are largely the same as Patty's and Kelly's. I'm concerned that the people who Rafter is the only way they have to get around. And it's not just the essential workers getting to work, but it could be people going to the grocery store, or that is their way. They always go to the grocery store, or to go to a doctor's appointment, those sorts of things. We need to continue to provide that service somehow or other. Now, within the city of Aspen, Rafter could cut back all the regular routes there, but they could still do an on-call service for the entire area of the Aspen routes. So maybe Rafter could pare back to a bare bones service, just do on-call service within the Aspen area. Some routes maybe have more people riding, like maybe up by the Castle Creek Terrace buildings. Maybe there's a lot of people riding from there into town. Maybe they would more just do a pared back service there, but continue doing service. And I think the Rafter survey could help determine that. In terms of the Down Valley service, cutting it back, like not having the local and the BRT both running up and down Highway 82, maybe just have one bus going up and down Highway 82. maybe not every half hour, maybe it's only once an hour or something during the middle of the day. It depends on when the periods of heavy use are, like people getting to their essential jobs. It would require a lot of publicity and retraining the public if these schedules are changed. But just in order to save on the keeping the service going, but cutting down on the exposure of the Rafter drivers to the public, letting the Rafter drivers who are sick get well so they could come back on the workforce. Cutting back the service as much as we can, I think, would be essential. Keeping it going to help the people who need to use it is essential also. Kelly.
Thanks. I have a question for John. Do you know, does the public health, I don't know, I guess have an interpretation that with the statewide stay-at-home order, does that help address some of the concern with the movement of the virus between communities?
Yeah, Kelly. I think all of the public health orders that are reducing the activity, and so what I'd point to are the statistics that George presented right at the beginning, that both as the state has implemented statewide orders, and then we've been tightening down our local orders, that ridership has decreased 90%, I think, was the number you gave, George. And so that does two things. It reduces the number of interactions that are happening as a result of transit, which reduces the overall rate of spread of the virus. And because of the load factors being so low on each bus, it presents the opportunity for appropriate social distancing while transport is happening. And so that may be a long-winded way of saying, yes, these public health orders are creating the conditions to slow the transmission of the COVID virus on buses and outside of buses.
Right. I guess I'm just saying, because there was a much bigger disparity, for example, between Pickens County's public health order and Garfield County's
Correct.
public health order a week ago. But with the state health order, everyone's brought more into line with more restrictions.
And
so I just offer that as maybe a change in how this alleviates some of that concern.
Well, this was a very important decision. That's why I wanted to have the board weigh in on this. It caught me a little off guard last week when we had public comments from the public health department, which I was not aware of that conversation. And so I thought it was really important for Greg and I to hear what the other commissioners were thinking as we go into our Rafter meeting tomorrow. So thank you.
Greg?
Yeah, I would just love to say I feel pretty good about this conversation, where it's going. I think that keeping some level of service does make sense. I'm wondering if we can make a public appeal to people just to change their habits. If they were going to the store every other day, maybe they can reduce it to once a week. We're trying to practice that. Reduce use. Let's just limit the use of the service, but keep it going. If people can show that the self-discipline just to not jump on the bus as they used to, but use it only when it's absolutely necessary for their own safety and the safety of others, perhaps that's a message we can put out, and we'll feel more comfortable about keeping that basic level of service.
Steve, can I?
Oh, go ahead, Patty.
Yeah, and Greg, on that point, I think if we allow the service to continue at some level, we let people know it's an essential service, which means you use it for essential purposes. So I think that'll help people. But I really support the board's looking at Rafter to scale down a little more. They've done a great job so far, but in order to continue providing service for workers and for people who need to access those essential services, I think that's the direction we need to go, and I'm seeing support from the board to go that way. Now it's up to you two to convince the rest of the members of the Rafter board to understand that it's a recommendation from our Board of Public Health and our emergency incident command team,
Incident
management team, to continue service at some level. Thank you, guys.
Hey, Patty, just to follow up on that, I want to make sure, on the meeting yesterday, correct me if I'm wrong, but I didn't think the Board of Health discussed whether Rafter should stay open or closed, but did I miss something?
It wasn't
Or was
discussed
this the
then.
previous? It was the previous.
I think it was another discussion that they had. It wasn't, or it just came from Karen, the recommendation to keep the service at some level.
Yeah,
Okay.
so that was, I'm
Recommendation.
sorry, just to be clear, yeah, that wasn't discussed at the Board of Health meeting. That's been discussed by public health staff through the incident command.
Same as the construction recommendation.
Yeah, and it's been discussed in our EOC too, and in transportation, and RAFTA's staff is actually heading that up. So sorry for the confusion there.
Thanks for the clarification, Greg.
Okay.
So, George and Greg, do you think it would be worthwhile for any of us to listen in on the RAFTA meeting tomorrow? Or could you give a report after the meeting's over, just shoot out an email to all of us with the outcome of
To you.
what's happened at the meeting?
Yeah. If you-
Sure, yeah, welcome to listen in, but, I could shoot out the results as well.
Send
with
it.
the conference.
Yeah, if you want to shoot them to me, I can distribute them out, George. We'll see if you get that email.
Okay.
Okay. I think that would be sufficient. I don't really need to listen to the ins and outs of the discussion, but if you could give a thumbnail sketch of what the discussion, the bullet points of the discussion, I think would be good.
Can do.
Thank you all. Appreciate that.
So is that all then on the stuff?
Yeah, I think so. I think that concludes that discussion, certainly from my perspective, as long as our Rafter reps feel like they have the direction that they're looking for. Okay.
We both give thumbs up. So, John, do you now have up on the board COVID-19 county update?
Yeah, I think that was kind of going into our open discussion, and this is not meant to be a comprehensive update, but I think both for the board and probably more importantly for the public, a reminder of where information can be found and information that's available. I'll just note this is our April 1st, 2020. Do I need to share this? There we go. April 1st, 2020 situation dashboard. We update this dashboard every day around 6 o'clock. So right now, I think the good news is the number of Aspen Valley Hospital patients dropped to 0 that are being treated for COVID-19. As the board knows, and for those in the public who don't, a lot of our efforts right now in terms of the public health order, in terms of the restrictions that we've been putting in place, are meant to slow the rate of infection so that we maintain adequate capacity in our healthcare system and especially our hospital to be able to treat the most severe cases and save lives at the end of the day. That's what we're doing. So that is why that metric is on the top of this list, and we're monitoring that very, very closely. Valley View, we have started getting information from them. They do have more cases right now. We're going to be monitoring their capacity going forward. There seems to be ramping up. As Kelly pointed out earlier, the communities entered into public health orders and social distancing strategies at different times, and we're hopeful that what we're seeing, and we're going to know this probably over the next couple weeks, is that those public health orders are helping us flatten the curve, and hopefully we'll see that flattening coming in Western Eagle and Garfield counties also. I just note that we are up to 260 now, so we do have people coming on and doing the symptom survey. For anyone listening, if you do have any symptoms, even if you think it's a common cold right now, if you would fill out our symptom tracker, to Steve Child's point earlier, we are trying to capture as many people, everyone who's symptomatic as possible. If you are not symptomatic, we also have a survey to understand how are we doing emotionally in the community, and what is our trajectory there, because that's also an important component of what's going on, and we want to make sure our services are matching that. So please fill that out. And of course, we have had 2 COVID-related deaths. This information is available on our website. We have a big button that says COVID-19 information as soon as you go to the county's webpage at www.pickenscounty.com. When you click on that, it'll bring you to this screen. If you click on what's highlighted in blue, Public Health Orders and Updates, and scroll down to COVID-19 updates, you can see every day's reports with that data that's been updated at 6 o'clock. And there's also additional information on those reports that may be of public interest. So any member of the public who wants this data, it's updated daily. On weekdays, we do try and provide some time for our incident response team on the weekends. So that is available. Obviously, our stay-at-home order, and this is going to be amended, but our current order, to the discussion we were just having, stay at home except for essential needs. Stay at home except for essential needs. If you're a visitor, we have asked our visitors to return home and to self-quarantine to protect their own communities. We've also, as everyone is aware now, asked hotel and lodges, as well as the vacation rental by owners, VRBOs, those sorts of facilities, to not accept any new reservations. Shout out to our lodging community. Several of our lodges have stepped up and offer support in our response. Our incident management team is now housed at the Limelight. We're having difficulty as we built our bench maintaining social distancing in the Mountain Rescue facility. So this provided much more square feet so that we can achieve appropriate social distancing and protect our first responders who are in our incident management team. So really want to thank the Limelight for that. And we've had offers from several other lodges if we need isolation or quarantine spaces, food deliveries for first responders. It's really been an outstanding community effort. And of course, as folks know, non-essential businesses must close for in-person operation. There was a Board of Health meeting yesterday where further restrictions on the public health order were considered and approved. That public health order has not come out yet. The language is being refined right now between our public health staff and our attorney's office. We expect that the new public health order will be issued later today. The major provisions or changes in the public health order are the time frame has been extended from April 17th to April 30th. That matches recent communications from the school district, as well as expectations for this event not being concluded in a couple of weeks here. I think everyone's sense right now is that the public health orders will likely need to be extended beyond that April 30th date. We in the county are bringing on epidemiological resources and support, as well as planning and facilitation support with public health expertise to help us get a better take on what data we do have, what we're seeing happening in other communities with similar restrictions, and try and get a better sense of how long we really will need these restrictions to be in place, but also then how do we unwind them? How do we incrementally step back in to new activity and or resuming activity and tracking key metrics to know, when do we need to hold on a stage or what have you. So that is to come. We do not have that plan yet, but we are working on it. In addition, sorry, George, do you want me to go through?
No, go ahead.
Okay. In addition to the extension of the timeline, there was a recommendation from the Board of Health and a motion and approval to reduce the maximum gathering size to 5 people from 10 people. That obviously does not include families who are under a roof that are larger than 5, but really the other types of gatherings that might be taking place. Social distancing is still required regardless of the size of group, whether it be 2, 4, or 5. That said, additional changes were really around aligning more with the state public health order in areas where maybe they were more restrictive. I know Greg and Patty were involved in that meeting. I don't know if you want to add anything to that discussion.
Steve, can I go ahead, Steve?
Go ahead, Patty.
Well, I think the discussion that the board needs to have is how we're going to enforce the issue around non-residents who are coming into the community, how we're going to inform them of the need for them to self-quarantine for 14 days, including any members of their family they bring with them and or friends or guests that they bring with them. We're going to need to get that word out there and figure out how we're going to do that. I have some thoughts that we maybe can talk about when we're talking enforcement later today. But I think that was critical. Mm-hmm. And the issue of how we're going to manage people who live in this community who decide to take a vacation and go someplace like Florida because Florida is open for business, and then they come back to this community, how we're going to deal with that and, any kind of self-quarantine we may want to mandate as part of a public health order. So that's another discussion that I think the Board of Public Health is going to have, and the Board of Commissioners needs to discuss in between now and then. But I think that about catches it all. I did just get an email from someone about an essential worker at the hospital emergency room coming in from out of town, and they tried to book a Airbnb, and they were told they needed a note from AVH certifying that they were an essential worker in order to stay in their B&B rental. So it's working. And the person who sent me the email thanked the county for doing that and seeing that it's actually working.
Great. That's good to hear. News. I know we've been doing outreach and trying to tighten down on those issues. Obviously, relative to our public health orders also, construction projects, we had given a timeline for those to button up. In the county system, we had 180 construction projects. Community development has stepped up in partnership with public health and the IMT. They contacted every one of those permit holders the day before. They've also done drive-by inspections and are helping the IMT ensure compliance with that. And there is a lot of compliance. The compliance has been good overall. Just like the ski areas closing, the retail closing, the restaurants closing, construction closing, these are all very, very painful for the businesses, very, very painful for the employees. These decisions have not been made lightly, and we hope by tightening down more now, we'll be able to open up more sooner. So, and Steve, I know George was trying to jump in earlier.
Well, Greg can give any further update from the Board of Health meeting. That'd be fine.
What I was going to comment on right now is that I don't know if you saw, but the governor a couple hours ago released a campaign called "We Need to Stay Home, Colorado." He's got our backs on this. In this case, where we can be very assertive, telling people to stay home. That's the new message across the entire state, for the state and for our community. So I don't think we should hesitate at all to follow up on this. I did want to say you're probably all getting the letters as well from the various people in the construction community who don't quite understand the gravity of this situation. My perspective last night on the Board of Health meeting was looking at a medical team, an incident management team, and hospital workers who clearly were all fatigued, stressed, and reaching a point of exhaustion, yet handling the situation very well. They're doing a stellar job, but what they were practically begging us to do is to close down unnecessary travel, send the second homeowners and the tourists home. They were, if they probably would have begged had they been able to. This is essential, and they're looking at human lives, and they're looking at a workload that they know is going to wash over them and completely overwhelm them coming in the next couple of weeks. So I think a strong message to the construction community that, yes, we know this is tough, but we also mean business, and the entire state is moving this direction. Although the state hasn't been as stringent as we are yet, I can anticipate they might be. But we have a unique circumstance with so many construction reliant people here. If we relax the rules with the construction, we're really not helping flatten the curve. And I think that's a message we could put out, perhaps from some of our local doctors who might be very passionate in a message they would have for our working community on why this is important. I didn't have anything else. I'm sorry if I went off topic there, but I think the governor's stay-at-home order is a great campaign, and we should adapt that and spread it far and wide.
I'd like to think we're a few days ahead of the state on that one.
But Steve,
Yep, as we have been, and as the board, the IMT, and the Board of Health, and John pointed out, we are ahead of the state on this, and we seem to see them following the wise patterns that our incident management team and our doctors have been following. Thanks.
Steve, can
Okay, George, let's have George next.
Okay,
He's been very
that's
patient.
good.
Great, thanks. A couple things. One is reading in an article in today's Times, Dr. Levin's very sort of grim scenario looking at how general models, looking at how the virus has behaved. I don't need to go into all of that, although it speaks to the need to restrict travel, prohibit second homeowners coming into the county. And it goes back to that earlier discussion regarding Rafter. But and when you look at construction, when you have half of the town of Basalt is in Eagle County, and the other half is in Pickens County, and Eagle County is still allowing construction projects go ahead, whether it's in Basalt or in Willits. And then we're all going into utilize the only grocery stores in the Mid-Valley, whether it be Whole Foods or City Market. And you've got this whole segment of the population that is not really able to, or probably not being able to, enforce social distancing. It's a dilemma. I was just going to also just comment on some of Greg's suggestions in terms of even though the Board of Health is now limiting to 5 people, it's interesting how that number has changed from 50 down to 10, down to 5. But when I see people recreating, and whether you're heading up on one of the mountains or going on one of the trails, you get 5 people together, there's no way you could separate yourself that effectively or efficiently. And I would agree with Greg that we should be limiting that down to 2 to 3 people, unless you're family members. I think the Board of Health should be looking at that. And also, the other idea that Greg has been pushing, which I support, I don't know how practical it is, in terms of having people check their temperatures. When we think about our essential businesses, there really are not that many when you think about the grocery stores, pharmacies, but also the restaurants that are open and providing takeout. Is there a way for the Board of Health to look at having those employers have to do a temperature check on their employees, if not daily, at least very periodically? Because again, when I go back to Dr. Levin's scenario, it's unbelievably scary.
Mm-hmm. So just to quickly address, we do actually have screening requirements for employees in all businesses that are open. We frankly are relying to a large degree on voluntary compliance with those, George, because we do not have the resources, obviously, to check or audit all of that. So the public health order does require health screenings of employees, and for employees that are symptomatic to be, not allowed on that work site. So that has been part of our public health orders and part of our communications to the business community, really from day one of our public health orders. In regards to the checks and such for organizations, I know right now we've been tracking down, we've gotten a lot of leads on thermometers and infrared kind of temperature checks and such. And what we're finding is the lead times are way out for those. I know in our own facilities in the IMT, for example, we take our temperatures when we go in every day. So some of that temperature screening is happening. In more public places, you may increase the risk of spreading an infection if you have to hold a device or actually have physical contact with the device. So we're trying to be conscious of that also.
Let's see, Kelly, you had your hand up.
Okay, can you guys hear me? I want to go back a little bit to the messaging of group size. I think to me, I think it's confusing to say you can have a group of 5, but you should only be spending time with your immediate family. And I would like to understand that a little bit better. To me, it's clear to say only spend time with your immediate family, regardless of what the size of that family is. And so I'm not sure what an acceptable group size of 5 looks like. Who is that composed of, and what is the purpose of allowing a variety of compositions? You know, I suppose I would understand if it's trying to help address social isolation for people who live alone, and giving some avenue to prevent the negative impacts of social isolation. But that's just a really, I think, confusing message for me, that I would like better tools to help message that to the public. So we can talk about that, or maybe John has some insight of that. And then I do also want to go back a little bit to the enforcement stuff that Patty was bringing up, because I do think there is appropriate things we can talk about in the public.
Yeah, so Kelly, one, I think we can challenge our PIO group and stuff to provide some clarity on this. I think the group size is a couple of things. There's still allowed activities in the community, whether it be while we've got a stay-at-home order. That stay-at-home order also does allow for outdoor activities to take place, and oftentimes there are informal kind of gatherings that occur that aren't planned, and we're trying to provide some guidelines to be sure that we're reducing those. There's also still business activities allowed, curbside pickups, deliveries, those sorts of things, and this starts to put a tighter boundary around how many people can be congregating in a place and while those activities are occurring. And so we can work on getting some better explanation around that. It also, as you have activities like critical maintenance and those sorts of things, putting some parameters around what a response can look like there. Mm-hmm. So there's a lot of reasons for having that parameter out there, and I hear you. Some help on clarity of message I think would be helpful.
Thank you.
Yeah.
And with regards to the enforcement stuff, what information are people being given at the airport as far as the requirement to go home or quarantine for 14 days and the services available to help them in that quarantine time? Yeah,
so that's, and particularly now as this public health order comes out, that's on our radar screen, Kelly, to better communicate that, whether it be, I don't know what the communications team is coming up with, whether it's a 3x5 card. Here are the expectations now that you're here, that we can ask the ABO and to be distributed as folks are coming off the plane. So that is being worked on in conjunction with the new public health order that has that quarantine requirement. We have had the conversation with the airport about, as soon as that material is available, making sure it's distributed both on the commercial and ABO side.
Okay, great. Thank you.
Yeah.
Steve, can I add to that? I have a suggestion as far as, I don't know if we can manage this, contact United, who I think is the only commercial airline flying in now.
That's it, yeah.
And they send out text alerts to their passengers. Your plane's late, your plane's on time, your plane's at this gate, your plane's. If we could give them something that they could distribute to people who are coming on United to our airport that says, just briefly, these are the expectations when you get to Pickens County as far as as far as self-quarantining yourself for 14 days if you're coming from out of state and you're a non-resident. I think that might be a great way if we can get United to assist us with that. And also, we might be able to use the electronic messaging advertising board for a public service announcement that just gives some brief information and directs them to the county website or something, so people at least know where to go to get information when they get off the plane.
And
So those are a couple of ideas using technology.
yeah, and right now, we don't have good GA numbers, but on the commercial side, we're having like 12 to 18 people.
Or less, 5 to
or
7 on
less,
some
or-
planes.
Well, no, in a whole day.
Oh, in a whole day.
In a whole day. And so our bigger challenge may be the folks coming in rubber tire.
Yeah, and
this
how do we
point,
control
how we
people
get
driving?
that message out. So we're trying to use multiple channels. The airport is definitely not the only place, but it is one place that people are coming in. And more people have been leaving, I think, in our recent data than coming in.
Only one jet at the airport the other day.
What's that?
There was only one jet at the airport.
So is it okay if I move on, or do you guys have some more questions?
Greg, did you have your hand up?
I think I'm good. Thank you. I did want to show you all the picture of the governor's order, which I'll just put up here briefly. This is the new ad campaign.
Hold it up a little hard.
Needs all those stickers on it.
That's actually pretty funny.
Yeah. Well, that's gone out, so I think we can certainly hop in, and it's nice to know that they're with us on this one.
Well, I would say I've been hearing mixed messages from the governor, from the state, frankly. It's interesting. The governor was on NPR 1A program the other day, and talking about the difference capacity between the mountain resort communities and the urban areas, which I understand. But his message was, well, the resort communities are pretty well shut down anyway. They don't have the influx of people. So right now they don't have a capacity problem, whereas the urban areas, it's business as usual. And then the next day, he talked about the importance of protecting the mountain communities in terms of limiting people coming in and out and visiting. So I'm getting a lot of mixed messages from the state, from the governor, and I think John will probably speak to this in terms of our requests and our communication with the state and the governor's office in terms of trying to meet our needs, because we know we're going to be expecting a surge here in the next week or two.
At the CCI Mountain meeting yesterday, the counties that are closer to the metropolitan area are being overrun by people from the metro area going up there to recreate and to get out of the city. They're having some pretty serious problems with regards to that. I think we're lucky here that we're far enough away. It's not a day's drive for people to get over here and back to the Front Range in one day. So we're not getting that kind of impact. And maybe that's the impetus behind the governor urging the people in the metro area just to stay home, don't go up into the mountains to recreate. So, John, you want to go on with your next?
Yeah. So just wanted to talk a little bit, and we can actually pop out to the actual website. These are our screenshots from our symptom tracker. And basically, this is how we're tracking self-report data around symptoms in our community. There's a few things. Am I still sharing my screen right now? Okay. There's a few things to look at. This onset of symptoms timeline is one that we're keeping a close eye on relative to our public health orders. And we're hoping that this is the trend, frankly, that we see, because we really got into issuing our public health orders starting March 12th. And as George pointed out, We agonized in terms of putting in place what at the time was one of the strictest, is actually the strictest public health order on gatherings and events that we could find in the nation at 50 people. That seems a little quaint now in our new COVID world, but that was really around the 12th. And you can see that right now, with the data that's been self-reported in terms of onset of symptoms, we're peaking out at the 17th, which is roughly what you'd expect to see, and we've seen some declines. Now, obviously, we don't have a lot of longitudinal data to work with. We have a limited sample size. I want to qualify all of this, but this is exactly kind of what we're looking for in terms of symptom tracking, and hopefully that correlates as we move on with infection, COVID-19 infection rates. So we'll be tracking this. Again, we need to qualify this, that this is not, I wouldn't say that this is absolutely statistically valid, but in terms of these 256 responses, we're starting to see some of the trends and such that we're hoping to see relative to our public health orders.
Steve, can I just, on the medical side of that, I think we also are going to need to take into consideration the beginning of allergy season. We're on the cusp of that, and then so many of allergy symptoms are the same as the symptoms here. So that's going to be a tough conclusion to try and draw when we're going to have people maybe coming in and putting in symptoms that are more allergy related, which mimic, the coronavirus symptoms also. So we're going to be heading into that season here, like today, when the wind comes up and allergens are blown around, like me, from working out in the yard. So we need to take that into consideration. I'm sure they will.
There's a whole lot. This is capturing everything. Yeah. It's not necessarily
right.
But in general, all infections we should see, you know, whether it be flu or the common cold, everything we're doing with social distancing and hygiene measures and such should be impacting all
So
of
you're
this.
telling me I no longer have to clean my house and get those dust mites?
I did not say that. Are you ready to pop out? Can you, well, just show the public where you can, and this information updates live.
And John, when you're transferring, I'll just note, Patty, I totally can relate. I mean, it was tough for me over the last couple of days to really be like, gosh, is this just a cold? Is this just allergies? Is this, what's the right thing to do here? I mean, making a decision to self-isolate is really tough when I've got 2 little kids and my husband's trying to work from home. But I just felt like, gosh, especially with my eyes swelling, I'm like, I've never had this bad before.
So treat it like you have it.
For anything. And, these are the symptoms that they're asking us to pay attention to. And so just do it. Even if it is allergies, make the decision to self-isolate and self-quarantine would be my message to the public.
So just kind of walking through, this is the type of data that's available. It's updated in real time. Eagle has, we have very similar, almost identical kind of reporting pages. I believe Garfield is doing the same. We haven't seen theirs yet, but do you mind just scrolling down into, just so you can see again what information you can, when you scroll over these graphs, you'll get the number of responses for each symptom by those areas.
I have a question about temperatures. Is it 100? Is it 104? Is it, this one says 100? We keep, that number keeps bouncing around. And
we're asking for 100.
Okay.
Yeah. So any questions? Steve, were you trying to jump in with a question? I'm sorry.
No, I wasn't. I was just trying to get Kelly on there, and she got on.
Oh, okay. All right. Maybe, Andrew, can we pop back to mine?
So I just stopped sharing. You'll have to click share screen again.
Uh-oh. Okay. Give me just a second. Did that do it? You guys can see it? I'm going to get, by the end of this, I'm going to know how to do all this stuff.
Wishful thinking.
Wishful thinking. Obviously, our public health orders, as we talked about previously, are also creating a lot of challenges for our workforce and our business community. As of yesterday, let me just step back. The board has made emergency appropriations to the county's emergency assistance fund. That's a fund that in a normal year we may be serving 20 or 25 people in. This board made an appropriation of $500,000 for that fund. The city of Aspen made a $200,000 appropriation, and Snowmass is preparing a $100,000 appropriation. As of yesterday, we had 1,200 applications for this aid. We're in the process of ramping up our capacity to be able to review and complete hopefully between 75 and 100 approvals a day. Like I said, that's not what we are stood up for. And so our approvals right now, as we both bring staff on board and get them trained into this approval process, it is slower than that. We are ramping up as fast as we can, and we have, again, good partnership from SCICO. We have, as of yesterday, completed 350 interviews and started into that approval process. As of yesterday, the average issuance of aid that was approved was $944 per an application. 87% of that was really to support housing, 6% for food, 7% for gas and other cash needs. What we will assume right now is that we'll be getting similar requests on a month-to-month basis, especially as families who right now have savings that may mean they don't need to ask for aid now, will likely need to ask for aid in the future. We believe that our first round of applications will draw down anywhere from $665,000 to $700,000 of this first round of appropriations. So we'll be looking, obviously, probably at another emergency appropriation. I just want to note, we have been putting ads out in both English and Spanish. Our aid, particularly with our emergency assistance that the board has appropriated, is not restricted to those who have legal status. The federal programs are. Our local aid is not. We have been extending that both through our nonprofit community and our emergency aid applications, regardless of legal status. There may be one or two of you that can read this ad on the right, but we do. I just want to note that we are noting that in our both our English and Spanish ads to encourage people to come to us.
Hey, John, regarding the Spanish ads, is there any way that, I don't know how I could access just that ad. Maybe it's in there somewhere, but just to have that document that we can post on social media and share with our Spanish-speaking community. I'm sure it's getting put out there, but I'd love to help if there's a link to it that you could put send to us?
Sure, I can actually send you the I don't know if it's called a JPEG anymore, whatever that file type is. I'd be happy to send those to you guys. And yeah, if you can put them out on your channels, that would be great. Small business support, of course, we're tracking closely the stimulus bill and the aid that's being made available to small businesses. We're working closely with the city of Aspen as well as our own recovery emergency support function, which is being headed up with Phyllis and being supported by Kara. We're working closely with the chambers and really trying to create more of a regional effort than just a municipal or county specific effort. So we've been working with the chambers from Glenwood Springs on up through Aspen, and we'll be ramping up our campaign there to make sure we're getting information out and that our community is able to leverage those programs. Internal planning.
Hey John, can I ask
Yes.
you a quick question? The city has been putting out some really great information. How is that integrating with the larger regional effort?
Yeah, no, we're all coordinated. So a lot of the information that the city has been putting out has been in coordination with those ESF groups, and so and behind the scenes, the conversation is happening with the chambers and municipalities. So we'll be leveraging a lot of that. Obviously, the Snowmass is involved in that discussion. Basalt's involved in that discussion. Carbondale and Glenwood.
I guess I'm just wondering because I know, given the city's very proactive efforts, I don't want the AABC businesses to kind of get lost in there. So do we need some targeted effort, from us to help with that?
So I think that those businesses are being captured in these overall efforts, Kelly.
Okay.
Yeah, so I'll double check on that.
Thank you.
Yep. Obviously, there's a lot of focus on internal planning. Next Tuesday, I'll provide you a little bit more thorough update on our budget estimates, what we're anticipating to happen with revenues, how we're projecting the unwind of this immediate economic shock that's been caused by COVID-19. I will say we're in a fairly good position because we are already anticipating a 2001 style recession in our budget and 5-year plans. And so the anticipated reductions that we're seeing from our budgeted revenues are going to be less, I think, than what you're seeing from some other entities around the state. That's not because we're not projecting a large total revenue decrease, but we're already planning for a revenue decrease. So more on that. Other conversation we want to bring back to you is we've been updating our capital projects list. We are now basically realigning that analysis on a couple of assumptions. One, that the public health orders and potential restrictions are going to be extended through the spring. We've already seen one extension. We're going to go ahead and assume that there will be another. And then bringing back to you all just how we had prioritized projects based on a matrix that was developed, that we developed at the staff level to show which projects have a public safety component or critical public infrastructure, may have other funding sources tied to completion, may have other environmental considerations that the board would want to make, and how we would recommend right now either holding on projects, either because they don't fall into those public safety or essential. We're also looking at maybe taking our foot off the gas a little bit on some expenditures. From a cash flow perspective, we'll be taking that into account. So we'll be updating those project lists. Staff is looking to have that initial analysis done by Friday. And then we've been paying a lot of attention to, there's a lot of new human resource policy requirements and benefit requirements coming down. We've been making adjustments to those, as well as our own flexible policies, both to be able to maintain workforce and move folks around as necessary. I just note that we were early adopters of giving 80 hours. That is now required with the passage of the stimulus bill to encourage folks to have flexibility in staying at home. As of our last pay period, we've had 66 employees report to HR for use of hours. 33 of those were due to illness or symptoms. 13 that were unable to complete their work through telework or working from home. In fleet and some other areas, we're working with creative scheduling. So we've gone to 36-hour, 4-day a week kind of schedules where we're overlapping folks. So we have fewer people in the fleet building so we can achieve social distancing. So they've been accessing those hours. We had 12 who are accessing them because of they themselves or have family members who are high risk. Right now, those hours I don't think are being overutilized, but I think they're being utilized in appropriate ways, and we'll keep tracking those.
Ellie?
Thanks. I feel unclear about what is happening with regards to the governor's executive order on property tax and sales tax remission from businesses, and I'm wondering, can we include that as part of our discussion on Tuesday?
You bet. And I think, at least from staff's perspective, there's probably, the order related to property taxes we see as potentially having minimal impact. The sales tax may be a different question. So, yeah, we can include that discussion. Thank you. The only thing I meant to talk about a little bit back here when we were talking about the data and we moved on is there's a really robust discussion at the Board of Health yesterday about the challenges with testing. And I think it's worth spending just a minute on that and ask Greg and Patty to jump in here too. Everyone is passionate about getting more testing capacity and community-based testing for Pickens County, for the state, and for the nation. And we have been working to identify a good testing solution for our community. And how we've organized ourselves now is we have a medical advisory group with staff from the hospital, as well as at least one local provider who's helping us to vet not only the tests, but also the process and purpose for testing. And what we've learned is we got very excited about some of the tests that were fast-tracked approved by the FDA, and that fast-track approval is not a full FDA approval. It doesn't come with all the data that the FDA typically requires in terms of a test specificity and in terms of its accuracy, in terms of positive and negatives. And so as these tests are implemented, we're learning some of that information. And so what we found is that even tests like the tests that we're hoping to acquire from AYTU, I can't pronounce the company now, the antibody test, may have some specificity issues with it, where it not only detects COVID-19, but may detect other coronaviruses, which can lead to a high false positive. And so we have been working every day with this medical community, vetting different tests that come out for how risky are they to implement for our healthcare workers? How PPE intensive are they? What is their specificity? What is their accuracy? What information can we expect to get from those tests that really benefit the community and don't present additional risks? And we're finding that as we dig more into the facts versus our passion for getting the testing done, that there are some real challenges with all of these tests, and we're taking a little bit of a step back to look at other vendors right now, and testing solutions in partnership with our medical community to make sure that our passion and desire to do this quickly doesn't lead us to a solution that doesn't get us what we want. And, I'd invite, I see Kelly's raising her hand, but I know Greg and Patty had an opportunity to hear from some of the medical community on this. So, Steve, I'll let you manage the meeting now.
Okay, Kelly first, and then I think George wanted on.
Sure. Mine is quick. I would be interested to hear what Patty and Greg heard yesterday. I heard from Summit County on a call we had yesterday that in terms of the traditional COVID-19 testing that's happening, that they have a direct contract with the supplier, and so they kind of get swabs and other medium on a direct basis. So that just might be a conversation worth having with them.
Yeah, and so that conversation actually did happen yesterday with the medical community and the IMT. I was not part of that conversation, but it's actually a testing protocol that we had looked at, and because of some of they're going to do about 200 tests, Kelly, which was part of what we were looking at doing with the swabs. But the medical community advised at that point that from a medical perspective, we wouldn't be getting the information that would change how they're providing care, and it wasn't enough to give us the epidemiological data. And so we had looked at that almost same scale about 2 weeks ago. So that was our understanding.
So, John, it just seems like this is becoming a little more confusing, not only for us, but for the public, because as we started with our first confirmed case, we put up 2 drive-through test sites using swabs.
Correct.
We had to cut one back because of the lack of supplies and needed to have the medical community triage with a one running drive-through. So then we heard about this new FDA-approved quick blood draw, the pinprick, to look at antibodies. and now we're looking at some other possible testing ways. So we still have the community saying we need testing, and what is happening, and what's the status of the test of those test kits that we have ordered, utilizing the antibodies as a criteria.
Yeah, so George, those are the ones that the medical community talked about yesterday in the Board of Health meeting, and it was not, that was one of the tests that was fast track approved by the FDA, so it's not a full FDA approval. And one of the things that we've learned is that the specificity of that test is not what we had originally thought. And so it's, you have a high false positive. Just like with the swabs, you have a high false negative, right? 1 in 4 of the negative results may actually be positive. And so we're trying to land on a test before we do community testing that we have more confidence in the specificity and accuracy of the test.
So the ones that we had ordered, are they still on order, or
we're still in line for them, but we are exploring other options right now.
And we have no idea in terms of the time
they've
frame
given us, yeah, they've given us no delivery date on those. I think the demand right now on every testing method that does either have the exempted approval through the FAA or an FAA approval is extremely high nationwide.
John, just this morning when I was on my medical appointment with Dr. Christine Giesel, she's in close touch with a medical doctor from San Miguel County who's been involved in their blood testing down there. And she said that they have done 600 tested 600 people twice over maybe a 2-week, test them once and then test them again. All of their tests came back negative in San Miguel County, which is, for them, she said that test is specific to the coronavirus, the new novel coronavirus. So they don't get any false positives or false negatives whatsoever. She said that the company doing that would love to do it in Pickens County also, if we would be interested. So I have, she sent me an email, which I haven't forwarded to you yet, but I will forward it with the information she has, and then I'll pass it on to you, and so the IMT can take a look at it, the medical community can take a look at it and decide whether they want to do that or not.
Yeah, they actually have already been in touch, Steve, with reps from San Miguel County, and I really applaud San Miguel County for taking this on. It is not this is a test that has not been either fast-tracked approved by the FDA or FDA approved. And so this is, I think, part of the process where they're looking at the specificity and accuracy of the test. I don't think that, at least from our medical community's review, that test actually, it's not being accepted by CDPHE right now for results. And I don't think we actually have the information on specificity or positive or negatives. There is no test for anything that doesn't have some level of false positive or negative. That's 100%. So,
John, if I could add on to that, Steve, the doctor who was part of our meeting in Board of Health yesterday had been in touch, and they have been studying the blood tests, and they think it's highly suspicious that all the 600 tests in Telluride came back negative. So I know they are really looking closely at every test that comes along. I am convinced that they're being incredibly thorough in vetting, looking at all these, and they're realizing false negatives and false positives aren't really going to lend us any sense of confidence. In fact, they may have the opposite effect. So I know they're looking at this, and I know everyone is so anxious. The thing is, one is this demand for testing is happening virtually everywhere. The pace to rush these tests out is incredibly rushed, and thus the quality of the information coming is questionable. And the one thing I can say is I was convinced after hearing from Dr. Levin, our chief medical officer, and the other doctors on the call, I think Greg Balco and maybe John can remind me who else.
Dr. Holmes.
They are being very thorough in vetting all of these tests.
We feel the urgency. Yeah, and I just want to assure the board, we feel the urgency, both from the community. We feel the urgency to have testing. We want to make sure that the test is the right test and giving us the information that we really think it's going to give us. And while we're learning from the doctors is this is more complicated than a biotech company saying we have a new test for COVID-19 and it's available. And we're trying to take a step back to match this urgency with facts.
If I can add just to that, just to close that side of it, there was an article on, a radio article on last night on NPR about the various fraudulent testing operations that are being shut down. The FBI is investigating so many, and I'm not suggesting any of these tests are fraudulent that we're looking at, but there are certainly a lot of con artists offering suspicious and useless cures and tests online. And so while we're always hearing about these updates of new tests, we have to really take all of it with a grain of salt because some of it actually is fraudulent behavior.
Kelly?
Thank you. Are there any expectations that our medical team wants to set as far as what an expanded testing protocol would look like? For example, are they trying to achieve like a random sample of symptomatic and asymptomatic, or will the expectation continue to be that the vulnerable populations or the priority populations would be who would be tested under any future regime?
Yeah, so Kelly, we've been fortunate to bring on some expertise this week so we can have exactly those discussions, because we have, I know in the discussions I've been in, frankly, we need to nail down this why. I mean, everyone reads testing's the answer, but the why of why you're doing it affects how you do it, right? And so if it's about getting a community sample of where we stand with spread and where, then maybe we should be doing it based on a stratified random sample of residents versus those who are symptomatic. If it is about driving a strategy of isolation and quarantine, you probably stick with some level of either symptom or high risk kind of population or area, so that sampling becomes really different. If it's for medical purposes, you probably do what we're doing now. And so frankly, I think depending on who you talk to, all of those are different reasons that people want to do testing. And so we're trying from an epidemiological perspective to nail down that why as we bring this expertise on, so that the how becomes a little bit more clear to us. So I'm sorry we don't have that answer, but we're asking the question.
No, that's okay. I do think that it will be helpful so that we manage the expectation of anyone who's thinking they want to be tested will or
Correct.
won't get tested as more information comes forward.
Absolutely, and I do believe that as we nail down the right test and capacity increases, which it will, we will have this more broadly available just to eliminate risk in the community. But until there's that availability, we're going to have to make choices like you're saying. How do we choose who gets tested and why? And I wish I had, believe me, I wish I had 17,000 tests in a box sitting next to me and I were delivering a different message. This is not the message we want to be delivering. It's not the message that any community nationally wants to be delivering. You just need to be assured the team understands the urgency, the medical community understands the urgency, and doing it right's important.
So I think a lot of what might end up happening is until we get vaccine for it, there probably will be a lot of people who will never know whether they had it or not. Once they can get a vaccine, if we can get a vaccine that works for the virus, then people will know that they've developed some immunity to it at that point, for sure, because they got the vaccination. So that might be 18 months out, but I think we'll get there eventually. I hope before that happens that we do get a good test that is highly reliable and we can do a fairly large number of our population. So thank you for the update on that, John.
Yeah.
Appreciate it. George.
Yeah, I just want to go back a ways, John. Since we are relying on our medical professionals and our Board of Health as we continue to look at ways to suppress this virus, and we take those recommendations and we endorse them. My question is, again, given that the Roaring Fork Valley, we've got 3 counties, we've got 5 municipalities, we interact with one another constantly, whether it's certainly at the grocery stores. How closely, I'm sure our public health department, and Karen is working very closely with her counterparts in Eagle and Garfield, but how are we doing in terms of trying to have all the counties come up with a consistent message and a consistent requirement?
Next question.
That started the conversation with Rafter, right? In terms of the concerns of people moving up and down the valley from one community to the other community. And if we don't have some consistency with our fellow counties and municipalities, we're not only not able to monitor and suppress our residents, but certainly theirs as well.
Yeah, so George, I think, we started off in almost perfect alignment with our public health orders and strategies. I think as the challenges that our different communities face, our economy and dynamic and risk factors in Pickens County as a resort community and how we're connected with the other jurisdictions is really different than even Western Eagle County or Garfield County. And so as the pandemic advanced, our public health orders started to reflect a little bit more, I think, those more unique community issues. All that said, Eagle County and Pickens County, we have a more restrictive public health order right now than Eagle County, but fundamentally, it's pretty similar. still. We started off with the same base. We've incrementally tightened ours up a little bit more, specifically around construction and group size. But other than that, our public health orders are substantially the same. I'd say, I hate to put a percent, it makes it sound more precise than it really is, but we're really 85 to 90% similar, 10 to 15% different. Garfield County is relying more on the state order, and I think going back to a conversation that we had earlier, it's either Kelly or Greg that brought it up. Sorry if I'm not attributing it properly, but that state order did provide more consistency, and so we do have consistency in terms of what's happening with restaurants and bars. We do have consistency at least through April 11th. I expect that we'll see extensions. I have not heard that the state's extended their public health order, but I would anticipate it will be extended. There's consistency with the stay-at-home orders there. So really, fundamentally, we're in pretty similar positions. There's incremental differences where our public health order is more restrictive, but it's really incrementally more restrictive. Fundamentally, we're very similar between the counties right now, either because of the state public health order or because of what we've done locally. I think our biggest challenge is going to be what happens with timelines. And, obviously if some parts of the state come out well before other parts of the state, that's probably our biggest concern versus the incremental differences between the public health orders we're operating under now. That was really long-winded. I'm good at that.
That's good information to have, so thanks.
Mm-hmm. Other questions?
Patty's been quiet for a real long time. I don't know if she's in.
Well, no, I'm just wondering if we're still going to have executive session at 11 o'clock?
Not at 11.
No, because I have a conference call with Senator Bennett in 2 minutes, but
Okay.
I don't know if anybody else is
Sorry,
going to participate.
yeah, that one longer. I think those conversations
but those are good
useful,
conversations we needed to have.
And appreciate you guys getting together off of normal time.
Okay. So is there anything else we could, Greg, you raising your hand?
Just very briefly, I know Christina King, who's on our Board of Health, has put together a lot of information on mental health resources. Mm-hmm. And we didn't have a chance to talk about it at Board of Health yesterday, but her concern is that all of the people that are on the front lines of this are, some of them are tired, some of them are exhausted, there's a lot of stress. Is there anything we can do to support the mental health of our community at large and of our medical workers? I just wanted to bring that up and say, let's keep that part of our messaging as well. And there are a lot of great resources out there on our page and on the Aspen Strong page. I think we've got good links set up for that. But let's remind people that they can find help to deal with stress and isolation at this time as well.
Thanks, Ray.
Okay. Do you have the citations there, John, for...
Let me see if I can pull them up here. Give me just a second. I guess I can stop
Steve,
sharing my
the
screen.
citation is 246402-4B. And the purpose is discussion of enforcement of public health order.
I wonder if we should have had someone else here.
I'll move to go into.
Can you guys hear me?
Yeah.
So are we ready at this point to leave our work session and go into special meeting on executive session? Does anyone else have anything else to bring up before we do that?
I'll move to go into executive session for the purposes of and discussion of enforcement of public health order per the citation John Ely provided.
Point 4, 6, 404B.
I'll second that.
Okay, Kelly moved, Patty seconded. Any discussion? All in favor, say aye.
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 Okay, we're all in favor. We are in executive session and also special meeting. So,
Hold on, let's, Steve, maybe we need a little bit of a break. Grassroots needs a minute to shut down now and for us to get off of a public channel. So maybe if we could take 5 minutes.
Are we going to do a phone call for this next part?
Yeah,
I think we can stay on it.